12 strange signs that your body wants more vitamin B12. This video is for educational purposes only, so do speak to your doctor if you suspect a deficiency. 1. Feeling ice cold. One of the most common signs of a vitamin B12 deficiency is a deep chill sensation in your feet or hands. When you don't have enough B12, your body can't make healthy red blood cells to deliver oxygen, and you struggle to make enough heat, so you feel the cold right down into your bones even when you're in a warm room. Low stomach acid or a diet low in B12-rich foods are common reasons that this can happen. Number 2 is vertical ridges on your nails. Some people with low B12 notice that the vertical lines on their nails start to become deeper and wider. This is very common in over 50s, where the stomach makes less acid, so it isn't absorbing as much B12 and less oxygen reaches the nail matrix, which stops the nail cells growing out properly. Drinking apple cider vinegar in water every day can help older adults to absorb more B12 from their food. Sign number 3, heavy tiredness. If you feel like you have a dragging tiredness, like gravity is always pulling your body down, while your muscles feel tired climbing the stairs or even carrying a small bag of groceries, and this happens even when you've had lots of sleep, salt, and water. This dragging tiredness means your cell's energy factor is maybe running a little low. If you notice that eating more red meats makes you feel better, this means that you likely needed more B12 and iron. Sign 4 is muddled thinking. This problem is common in people who are on a plant-based diet who don't consume enough meat or fish. You may feel down, not necessarily sad, but just very numb, blank, or empty, where you can't find words or ideas, and everything takes more mental effort. You might also get sudden bursts of irritation, crying spells, or mild paranoia. You see, your brain needs B12 to make neurotransmitters like serotonin, so without enough, you'll just mentally feel quite off. By the way, I'll be sharing a full set of strategies to boost vitamin B12 naturally later in this video. But before we continue, I'd be so grateful if you could like the video, subscribe, and turn all notifications on so that I can keep you updated on the latest health and nutrition tips. Coming back now to sign number 5, a fast heart rate. Your bone marrow uses vitamin B12 to copy DNA and build new red blood cells. But if you don't have enough B12, the cells can't divide properly, and these blood cells grow too large, causing your heart to work harder to pump oxygen, causing a faster heart rate. If your pulse is above 100 beats per minute when you're at rest, it could indicate low B12 or anemia, so it may be worth a visit to your doctor for a quick blood test. Sign 6, electricity feeling. Have you ever fallen asleep on your arm and then your hands feel all electrical and tingly? Well, this happens because you block the oxygen flow to your nerves temporarily. But with low B12, the coating that surrounds your nerves can begin breaking down, so your nerves start misfiring and you get these little shocks, buzzes, or pulsing sensations under your skin. 7. Feeling off balance in the dark. When the nerve coating breaks down because of low B12, you may start to walk with a wider gait or stance. You might not feel where your feet are, especially in the dark, like you can't trust your steps, or standing still with your eyes closed becomes weirdly difficult. Again, this can be improved over time by gently correcting the deficiency with B12-rich foods and remedies. 8. Ringing in the ears. A deficiency in B12 can also slow down nerve signals from your auditory nerve, so the brain misinterprets these signals as sound and you start to hear a high-pitched ringing or a buzzing in your ears. This can also be related to low folate, which is vitamin B9, also linked with anemia. Number 9 is quite interesting, a pale inner eyelid. If you gently pull down your lower eyelid, the inside of it should look pink or red. But if you're low in B12, it causes you to have less hemoglobin in the blood, which has a red color. So the soft inner eyelid starts to turn pale with a more whitish tone rather than red or pink. Number 10 is a smooth tongue. Your tongue is constantly growing new skin cells with the help of vitamin B12. But with low B12, the surface of your tongue may become smooth or shiny, inflamed and swollen. And people also tend to have mouth ulcers more often with low B12 for the same reason. A good quality B12 supplement can usually help with this. 11. Blurry vision. B12 is needed to protect the coating around your optic nerve. So if you're low, you may get blurry vision that comes and goes, especially when you're fatigued. Many people also notice pale patches in their vision, like dead zones, or just a dimness and a cloudiness. And number 12 is feeling breathless when you talk. If you often get halfway through a sentence, but you feel like you run out of air and you have to pause to catch your breath, know that this is an often missed, weird sign of low B12. You see, with less B12, less red blood cells and oxygen reach your vocal muscles, causing you to need that little gasp in the middle of a conversation. And I'd also like to add one final but unusual sign: stomach burning. If you get a burning lower down in your stomach, which tends to go away when you eat, this is commonly linked with internal ulcers or gastritis. This is important to know because people who have ulcers also tend to be low in B12 because your body uses it up when it's trying to heal those pockets of damage. So how can you test for vitamin B12? You can get a standard serum B12 test, which measures the total B12 in your blood, but this isn't the most accurate test. Some forms of B12 in your blood are inactive, so you could still be deficient even if the test says that you are in the normal range. A more accurate test is the NMA, methylmalonic acid test. If your NMA is high, this means that your cells aren't getting enough active vitamin B12. But what causes people to have low vitamin B12 in the first place? Well, vitamin B12 is involved with hundreds of cellular reactions, from making DNA, forming red blood cells, insulating your nerves. It helps make energy, methylation, and so much more. The recommended daily allowance suggests that adults need between 1.5 to 2.4 micrograms per day from foods. However, for most people, it's just not fully absorbed. Modern functional medicine research suggests that we may need between 10 to 30 micrograms from food, especially as we age, and even higher doses between 1 to 5,000 micrograms from supplements, because only 1 to 2% of this gets absorbed by most people. It's estimated that now over 40% of the population has some level of a B12 deficiency, mostly because of digestive problems. The most common cause of this is having low stomach acid, where your stomach acid is not concentrated enough to absorb B12 properly from your food. This is especially common in people who take antacids or proton pump inhibitors for digestive issues. You might also simply not be eating enough B12-rich foods, like red meat, eggs, or fish, to meet your requirements, especially vegans, vegetarians, or elderly people. The common diabetes medication called metformin can also block B12 absorption. Drinking alcohol every day is a very common cause of low B12. Or changes to certain genes can affect how the body utilizes B12. And in this case, you'd simply need to eat or take more of it. So as you can see, there are a range of different reasons that you may become deficient in vitamin B12. However, there are many strategies that you can use to raise your B12 levels regardless of the cause. So let's have a look. Red meat. Aim to eat at least 6 ounces of red meat 4 times per week, like beef, lamb, or liver, to naturally boost your vitamin B12 levels. You can also get good doses of B12 from clams, mussels, oysters, eggs, salmon, crab, and sardines. If you're a vegan, you might want to try chlorella powder, which is a dried sea algae and a natural source of B12. For long-term deficiencies, you might consider using the sublingual under-the-tongue supplement of B12 in its active form called methylcobalamin. At least 3,000 micrograms daily is the usual recommendation. Some blends also contain adenosylcobalamin, which is used more by your mitochondria in the cells to make energy. Improve absorption. Before meals, drink 1 tablespoon of apple cider vinegar mixed in a glass of water. This strengthens the pH of your stomach, allowing you to digest and absorb more B12. Restore the stomach lining. If you're a person who has ulcers or H. pylori infections in your stomach depleting your B12, you might consider cabbage juice and zinc L-carnosine to help restore the stomach lining. More information on this on my Foods to Heal Stomach Ulcers video. And I'd also like to mention, if you're taking folic acid as a supplement, this can sometimes mask a B12 deficiency and even fool your doctor. So you may wish to use the more natural form called methylfolate if you want to avoid this. The types of B12 to avoid. Never take the common cyanocobalamin supplements that are available over the counter. These are cheaply manufactured from cyanide and bacteria, and they're very poorly absorbed. Stick with the natural methylcobalamin, adenosylcobalamin, or hydroxycobalamin for the best effects. Thank you so much for watching. I wish you great health, wealth, and happiness.